Today's lecture is going to be on the muscles associated with the knee joint. The first one that we're going to look at is going to be the rectus femoris muscle. This muscle is considered to be a two-joint muscle group because it not only flexes the hip due to the origin of the anterior inferior iliac spine and portions of the acetabulum, but its primary job is going to be extension of the knee, and also it creates an anterior pelvic tilt or rotation. And specifically, when we're talking about an anterior pelvic tilt, we usually tend to see the hip tends to be more in a flexed position. The other quadriceps groups, they're not considered to be a two-joint muscle group because the origin is located on the femur and not at the hip itself. So its primary job is going to be extension of the knee. The origin is the whole length of the linea aspera on the condyloid ridge. So it's a very long origin. And then we see it inserting in two portions. The first portion is going to be the upper border or the medial border also. So the upper and medial border of the patella. And then finally its termination point is going to be at the tibial tuberosity. The vastus lateralis, again, is not considered a two-joint muscle group because its origin is going to be on the femur itself. In particular, it's on the intraconteric line and the upper half of the linea aspera. And this time what we see is it's going to insert predominantly on the upper to lateral portion of the patella. And then again, just like the vastus medialis, it's going to terminate at the tibial tuberosity. So when we're looking at the hamstring group, this is also considered to be a two-joint muscle group. First off, it's because it not only extends the hip, but it also primarily flexes the knee. So again, when we're looking at a two-joint muscle group, it means that its origin is going to originate at the ischial tuberosity. It also originates on portions of the lower half of the linea aspera. And then we see the insertion is going to be on the lateral condyle of the tibia and then the head of the fibula. So it plays an important role of not only flexing the knee but extending the hip, but it also works with rotation factors of the hip. So the first one that it does is going to externally rotate the hip. It also causes external rotation of a flexed knee. And it also creates, when it is contracting, it's going to create a posterior pelvic tilt. So the semimembranosus, again, is a two-joint muscle group because the origin, again, is going to be on the ischial tuberosity. It not only flexes the knee, but also extends the hip. And we also see it play a role in hip internal rotation. We also see it play internal rotation of a flexed knee. And then again, it creates a posterior pelvic tilt. The popliteus muscle is important because it initiates flexion of the knee. It originates on the lateral condylar surface of the femur, and then it's going to insert on the upper medial surface of the tibia. But most importantly, it does internal rotation of a flexed knee. So it provides the ability for the tibia to rotate for weight bearing on the medial side of the femur and the tibia. The semitendinosus, again, is a two-joint muscle group. It not only flexes the knee and extends the hip, but we see again that the origin is going to be located at the ischial tuberosity, and it's going to insert at the medial surface of the tibia. It does internal rotation of the hip. It also does internal rotation of a flexed knee for weight-bearing purposes. And then it also creates a posterior pelvic rotation or tilt. So the primary nerves that we'll look at concerning the knee joint are going to be the femoral nerve. And one of the reasons we look at it is because of the compression factors that occur in the lower back, specifically between the spinal nerves of L2, 3, and 4. The femoral nerves, it's going to have a cutaneous intervention, which is going to be not only the medial side of the quadricep and the patella, but also the medial side of the lower half of the leg. But primarily what we're looking at is the sensory and motor information of the rectus femoris. We see it innervate into the vastus medialis, the vastus intermedius, and finally the vastus lateralis. The sciatic nerve is composed of two divisions, the tibial and the fibular division, or sometimes referred to as the common peroneal division. Its origin of the spinal nerves are going to be through L4 through S3. It travels through the greater sciatic notch, which, as we learn, the piriformis muscle is going to also cross into this, one of the primary external rotators of the hip. The first one that we see is the tibial nerve, what is going to innervate into the semitendinosus, the semimembranosus, and then also the long head of the bicep femoris. The other division, the peroneal nerve, is going to originate into the bicep femoris short head.